Cancer is a diagnosis that no family wants to receive. Fortunately, we've come a long way in treating childhood cancers with a survival rate of 85%. But surviving and ensuring a child's best quality of life are not the same goal. At Children's Hospital, we want to do better. We want to partner with the CIBC Foundation to fight childhood cancer in our region. Your support will help improve pediatric cancer research, screening, diagnosis, and treatment, providing hope and healing for children and their families.
I'm Dr. Alexandra Zorzi. I'm the Division Head of Pediatric Hematology Oncology at Children's Hospital London Health Sciences, and I'm also an Associate Scientist with Lawson Health Research Institute. Our cancer program at Children's Hospital is really a comprehensive cancer program for the entire region with a very large catchment area, actually. So clinical research in pediatric oncology is absolutely vital to the improvement of cancer outcomes for children and families affected by childhood cancer. Undergoing and undertaking clinical trials is a lot of work, in that there's a lot of regulatory oversight, there is a lot of incurred costs with equipment and tubing and education and support for patients and families. And this is not something that is funded through our public healthcare system. And so the ability to offer this at our children's hospital is really founded upon the fact that donors support clinical research at Children's Hospital.
For Gabby and her family, the opportunity to enroll in a clinical trial profoundly changed their healthcare journey.
In August, we all had a summer cold. It was pretty nasty. And while we all recovered, Gabby did not. She spiked a fever of 104. We couldn't get it down. And then she started coughing at night, and I thought she had pneumonia. So after a very long night of her coughing, I was up with her all night. I took her into emergency to check that she did not have pneumonia. And within 2 hours of being there, we were told that she did indeed have leukemia, and the coughing had been heart failure. We knew that Gabby's cancer had returned during a routine lumbar puncture or a test on the fluid in her spine that happened 2 years into treatment. So she was only a few months away from being done, and we really thought we were in the clear. So we were there for a regular clinic day. The mood in the room changed. We weren't sure what was going on, and then the news was brought back to us that they had found cancer in that routine test. At that point, they gave us about 7 days to go home, get rest, do anything that we were hoping to do before we had to start it all over again. So another full 2 years of treatment. We found out about the trial, which was run by a few researchers at LHSC and Children's, through regular discussions during that week and the weeks following about what the protocol would be for Gabby to handle her relapse.
When Gabby unfortunately incurred a recurrence of her leukemia, this was an active area of study of how we can better improve the outcome of children who experienced a relapse of acute leukemia. And certainly when your cancer recurs, we are in a very difficult therapeutic scenario. And we heavily rely on clinical trials in order to improve on those outcomes and learn from our patients with these difficult and hard to treat cancers, such as a leukemia that has recurred. And so at the time of Gabby's recurrence, there was a new clinical trial being offered by the Children's Oncology Group, which we had prioritized here at Children's Hospital, which was looking at a novel agent, which is quite exciting in pediatric oncology because it's not often we have new agents to study, to see if whether this new agent named blinatumomab would improve the outcomes or at least be as good with less side effects of how we currently treated recurrent leukemia.
There's a lot that we learned about clinical trials as we encountered the option to participate in one. And there's a lot that we learned about pediatric oncology and the landscape of treatment while we went through this. It's important for me to say that so that everyone can understand the significance of this trial, what it meant to Gabby, and what it means to the larger pediatric community. What we learned is that there are very few, approximately 2 new treatments that have been approved for children in decades. So some children are still receiving the same styles of treatment that Terry Fox did. This was an opportunity for Gabby to receive something new, something that hopefully wouldn't have the same damage on her body, the same lasting effects, or the same immediate effects that chemo did. It gave us hope that we would be able to conquer the cancer this time. Each new time that a cancer returns, it's more difficult to treat. The treatment options are more limited. The outcomes, the success rate goes down. So this gave us so much hope. This was something new. Maybe the odds would be in our favor this time. Maybe she would survive.
Donors should support the program of clinical research at Children's Hospital because really they're making an investment in the future of our community. No one ever dreams of being affected by childhood cancer, but certainly when that happens in your community, as a donor, you can have confidence that the care that they are receiving at Children's Hospital is sound, is delivered with compassion and empathy, but is also the state-of-the-art technology that child and patient requires, that is being delivered in their own backyard.
Gabby is wonderful. She's 13. She's creative. She's funny. She's social. She's doing well in school. She loves her friends. She especially loves her big sister. So we are one of the fortunate ones. Children who relapse currently do not have great success rates at times. So it will never be that I'm not grateful or eternally thankful. But we have to look at these opportunities for research, not just as solutions to survival, but as solutions for these children to come out of this with less harm, less lasting effects, disabilities. This research is going to improve the way they get to live those lives that they fought so hard to keep. And that impact is immediate, and it lasts forever. So everyone that has worked with us to keep Gabby going through all of this, to save her and to allow me to keep her, is now part of the journey that she gets to have for the rest of her life. That's the impact that this research has. When you donate to the research at Children's, you are saving the lives of the children that are experiencing pediatric cancer.
Children's Childhood Cancer Research Program needs to raise $400,000 a year to support the clinical research work. Community support helps fund research assistance, equipment, testing, medication assistance, and support for families enrolled in new treatments. We ask the CIBC Foundation to join with others to support fighting childhood cancer through clinical innovation and research.